for taking the time to spend with me today to talk about osteoporosis and osteopenia and lifestyle management. I really appreciate you spending the time with me. It's been a fun experience having the virtual interaction with everyone. It allows us to really explore deeper, as deeply as we can, in a different type of format, rather than having to run back and forth. And it's been a fun experience. So rather than sit and lecture to you for the next 40 minutes or so, I want you to feel very comfortable asking questions as if we were in the same room together, meaning that you're all here for a reason and you have questions that I assume you want answered. So as we go through, or as I go through the things that I think that you want to learn about, I want you to feel comfortable to ask me questions as we go through, as if we're having an interactive conversation. So when you go through at the bottoms of your screen, and forgive me because I usually have somebody with me explaining this. So if you go through at the bottoms of your screen, you'll see the Q&A and the chat. I know we're all supposed to be very well versed in this already, but if you're not, like me, at the bottoms the bottom of your screen says Q&A in the chat or the raise hand. You can go ahead and type a question in there, or in the Q&A or the chat, and I'll keep checking in there and answer questions as we go through. There's a really good chance that the questions that you have are questions that other people have as well. And I don't want you to feel that you are interrupting at all. Again, this is meant to be interactive, and just because this is virtual doesn't mean that it's not interactive. So please feel free at any time to ask anything that you want. So again, this is about osteopenia and osteoporosis and bone health. It is the month that we are making all of us aware, or putting an emphasis on bone health. As women in particular, we are at a greater risk to protect our bone health. And why do we want to do that? Why do we care about our bone health? So bone density, what is it? It's our bone mass. And what is it? Why do we care? As we age, typically after the age of 30, when our bone mass peaks, we slowly begin to lose our bone mass, causing our bones to get more brittle. And if you don't know this already, as our bones get more brittle, this puts us at a greater risk for fractures. And we're looking at a quality of life issue. And as we age, we really want to have a very strong quality of life. And I'm assuming that's why all of us are here, whether it's for ourselves or someone we care about or a loved one. It's interesting, as we're growing up and as we are younger and we don't think too much about, we don't think our bodies are invincible. And we're hearing as we're growing up, drink your milk, drink your milk, drink your milk, eat your yogurt, do all these things. It really was important getting our bones as strong as they can be. I forgive my it's not a distraction, but I'm glad that somebody put something in the chat, and I'll answer that question in a second. We want to make sure that we're getting as much bone strength as we can by the age of 30, because again, that's when it starts to decline. Our bone health starts to decline. Unfortunately, during those ages, we don't really understand the value of it. So it's sort of a catch-22. And I did forget to mention two things. One, this session is recorded. And also when somebody puts something in the chat, I'm going to not mention names. So everything will be confidential. So one of the questions in the chat, which is great, why do women suffer from osteoporosis more than men? And the answer is estrogen levels. So men definitely suffer from osteoporosis as well, but as women's estrogen levels start to decline, that is one of the risk factors of osteoporosis, osteopenia as well. The hormonal differences between men and women. So great question, great question. So bones are in a constant state of regeneration, constant, our entire lives. So the moment that we're conceived, and new bone is being made and old bone is being broken down. And when the breakdown happens more than the regeneration, that is one reason why osteopenia, and or osteoporosis can occur. And typically, again, that starts to happen with our aging process as well. So that is one of the reasons why that can happen, and that is a hormonal situation as well. So what are the differences between osteopenia and osteoporosis? And there are two very distinct differences. So osteopenia is a weakness in the bone, and the bone is weaker than normal, lower bone density, but it's not diagnosed as osteoporosis. And osteoporosis is when bones are very weak and very brittle. And sometimes they're so weak and brittle that even bending over or coughing can cause a fracture. So there's a fine line in a diagnosis in a DEXA scan, and that is where that diagnosis occurs. And again, if anybody has any questions, feel free to go ahead and just put them in the chat. And if they come up, we can always go back to these topics as well. What's interesting about osteopenia, which we tend to not realize until a diagnosis happens, is that there are two causes of osteopenia. One is the obvious, which I've been talking about, a loss of bone mass. But in addition to that, there can be a person's failure to never have reached peak bone mass. So if you think about that concept, it's really quite fascinating. So when a person, for example, is of a certain age, let's say younger than you would anticipate, than a person would anticipate of being diagnosed with osteopenia, soft bones, let's say in early 30s, and their doctor prescribes a DEXA scan for various reasons, and a diagnosis comes in of osteopenia, there is a chance that that person may have never reached their peak bone mass before the age of 30, during that time where we had, or that person had that opportunity to develop that harden, that full bone strength, which is really interesting. In a way, I'd like that person, if that person needs to hear this, in a way, it's somewhat relieving, because it can be a very scary diagnosis at a young age. There's a question I'm going to answer. Okay, so it seems like there's a problem with the connection. Is there a, I keep freezing. So
You're not freezing on my computer, Erica. I don't experience that. So I'm not sure if it's on the recipient end. I can't answer that.
okay, does anybody else have that problem? If they do, if they can just click in, it would, just let us know. And that would be helpful and we can see. Okay. Okay, so no other problems. So the person who is having the difficulty, maybe move the screen, move your computer. I'm not sure, so forgive me. I don't mean to sound rude if I am sounding rude. Okay. So there's a question, a statement about the diagnosis of osteopenia and supplements or food. I'm going to get to that in a minute, and great question or great statement question for sure. So with the diagnosis of osteopenia, again, there's two situations. So there's either that loss of bone mass or the failure to reach that peak bone mass. And that's a great question. What can a person do? A supplement or food? And that's terrific statement, because when a person is diagnosed with osteopenia, you have this brilliant opportunity to work to prevent the progression into osteoporosis. So at that point, you want to work very closely with the diagnosing physician, whether I assume it's your endocrinologist that has diagnosed you, and you want to figure out at that point what you want to do. So typically, you're looking at several options here. And whether or not the doctor, your endocrinologist or physician, whomever it was that diagnosed you, wants to put you on some type of medication as a first line of defense. Then in addition to that, and there's several medications that your doctor can review with you, you want to look at additional types of supplements and food. And I'll talk about that in just a minute. But there is something I want to keep in mind also. I want to take a second and look at risk factors for both of osteoporosis and osteopenia. So when we're looking at risk factors, and again, I mentioned female, or we mentioned being female, but also small framed, low body weight. We talk about that, and low body mass index. I've had this conversation with many clients of mine, and it's a very hard situation to find balance at, because at what body mass index do you put on weight to combat bone health? So while you might be at a greater risk factor, it might be a risk factor when you have low BMI or low body mass. It doesn't mean that gaining weight is the solution to fighting or gaining bone strength. So that's a different story. So that's something different. Now, again, over the age of 50 is another risk factor, but it doesn't mean that you're steer clear of osteopenia or osteoporosis if you're under the age of 50. Not getting enough exercise, poor diet, one low in vitamin D and calcium, again, not allowing your bone mass to have reached its peak. Smoking, too much alcohol, as well as a history of steroids and steroids from a medication standpoint. So I'm not talking about, having an, knock on wood, but having an allergic reaction to something and going on steroids to fight something once in a while. But a person who is on constant steroids for various disease states and has to be, you are at a greater risk for bone health issues. certain eating disorders as well because of the lack of certain nutrients. Now, one last risk factor that a lot of people don't keep in mind or isn't at the forefront of a lot of people's brains is undiagnosed celiac disease. So when a person is diagnosed with celiac disease, sometimes it's been years before that diagnosis actually happens. So as soon as a person, and I say finally, gets diagnosed with celiac disease, the recommendation is for that person to have their bone health, have a conversation with their doctor about their bone health as well, osteopenia, osteoporosis. Because what happens with celiac disease is that absorption issues have been going on. So absorption of certain nutrients, calcium being one of them. So there's a really good chance for a certain amount of time, calcium has not been absorbed within the body. So we want to make sure that the bones have been taken care of. And so if somebody's been diagnosed with celiac disease, I'm making this up, but if at age 35, then we don't know for how long that person has been not absorbing calcium within their bones. So keep in mind, every time that somebody has a diagnosis of celiac disease, we want to think bone health, celiac disease, bone health, celiac disease, bone health. So back to the question of at age 58, bone density scans showing osteopenia, what do we do? So what's interesting is that at age 58, there's a few things to think about. And this first part, again, is conversations to have with your physician for sure. And this first part of it, whether or not you have entered menopause. So when you speak with your physician and you look at your past you look at your medical history, whether or not you've had your biggest estrogen dip. In other words, there's the idea that when you've entered menopause that you've had your biggest dip in estrogen. So the greatest amount of loss of bone will have already happened then. So this is a conversation, a very good conversation to have with your endocrinologist when thinking about how to treat your bone health. Now, this isn't a be all end all, but it's when you're thinking about whether or not you want to add in medication to lifestyle changes, nutrition and supplements as well. So if you've had your biggest estrogen drop already, then have you had your biggest amount of bone loss already as well, if that makes sense? So with your biggest estrogen drop, have you had your biggest bone drop? And so now, if at 58 you've had that already, if you have osteopenia now, your constant loss of bone, is it going to be very slow, or are you still waiting for that big drop that will put you into that may put you into osteoporosis? Depends on everybody's stages of entering menopause. So that's a very personal conversation. So that's number one. So that's the umbrella. Then number two, what do you do? Supplements or food. So a lot of times, well, first of all, you're definitely going to start with food because you want to follow a healthful diet. So you want to start taking a look at your diet, and you want to start taking a look at how much calcium and vitamin D you're taking in. Yet you also want to look at how much calcium and vitamin D you're actually absorbing. So these are two different things. And this can be done through a 24-hour urine test. And this is very important to do as well, because finding that balance is key. So taking in too much calcium is not always a good thing. So taking in too much vitamin D is not always a good thing. So you want to get some conversation going and some lab work done as well. It's not easy to, I will almost want to say it's virtually impossible to overeat calcium and vitamin D, because when you're taking in these nutrients through food, your body has this unique ability to take in what it needs and to virtually either store or eliminate whatever it doesn't need. When you take anything in through a supplement form, whether it's calcium, vitamin D, or something that's really not proven to have any substantial help to your bone health, it can bombard the system and we don't know what it's really showing. So you want to start taking a look at exactly what it is that you're needing first. So you want to start thinking about how much you're taking in through food, how much dairy you're taking in, if dairy is your choice to getting calcium, how much vitamin D you're taking in, which is very difficult to take in through food. And of course, sunscreen is one of the main reasons why even being outside is very difficult to absorb or get in vitamin D, and it's very difficult to get it in through food. So how much vitamin D are you taking in? So getting that lab work done first is important to do for sure. Any other questions so far before I continue? Okay. To the person who was having the breaking up of the screen, is everything okay? I hope. If not, you know, this will be recorded, so hopefully you can pick it up at a different time. And then if you have any questions, you can always email me for sure. Okay, so elaborate on the lab work and tests we should be taking so we're proactive in this matter. I'm a 40-year-old woman. I've noticed that a lot of information goes unnoticed until it's too late. Doctors don't proactively take tests unless you come to them with a problem. It's a great question. So to your point, so there's a couple of things with osteoporosis and osteopenia. The symptoms, specifically with osteopenia, there really aren't any symptoms because there's no pain with osteopenia. Sometimes there's a little bit of loss of height in a person, but even that's hard to tell because it seems like you'll go to one doctor and you'll get on a scale and they'll do your height and it's 1 inch difference than it was somewhere else, and everything is just a little bit different. Then you stand taller and everything is off a little bit. And you're right, it's hard to really diagnose. And then sometimes with osteopenia, the symptom is fractures, frequent fractures, stress fractures, overuse injuries. And if you have those risk factors that I mentioned, low BMI, not getting enough exercise, or fair-skinned or female, but even if you don't have those risk factors, you know, it doesn't mean that you're immune to having osteopenia. So having a DEXA scan is really the only way, or bone density test is really the only way to diagnose whether or not a person has osteopenia or osteoporosis. One of the challenges with that is insurance coverage. So if there's not a cause for it, and I mean this respectfully to all of us, there's a really good chance that insurance won't cover it. Pricing, I'm not sure how much all of them cost, but paying out of pocket for it, if there's not a risk factor for it, for osteopenia, it might be more prudent to, I'm not sure how to say this, if you're concerned that you have osteopenia, it might not, I'm not sure if it matters to know, but I'm not sure if it matters to know. I can't explain it any other way. It'll come to me how to explain it. So, you know, so one of the things that, but to the point of the other lab tests, one thing that would be interesting is to know your 24-hour urine. Now that's a different story. So if you are curious to know how much calcium you're absorbing, or whether or not you're absorbing your calcium, that's a different story. So you would ask your doctor for a 24-hour urine test. Now, whether or not it would be covered, that's a question to have with your doctor and your insurance company. The only challenge with it is that it's not a fun test to do. In other words, you need to do it, you need to catch your urine literally in like a little bucket and then pour it into a jug. So 24 hours worth of your urine. So you don't have to be home, but you need to not miss any of your urine for 24 hours. So then you take it to the lab and then you do your measurement. They measure it for you. And this way you can see how much calcium you're absorbing. And that's a really strong tool to have. And it's a hassle to do. Is it worth doing? Absolutely. I've done one and it's a really good tool to have. So I hope that that's helpful. And that is an interesting tool to start with, I would think. So if you wanted to do that, that might be something that would be of interest to you. I hope that answers your question. If you have a history of stress fractures, then I think I see the question about Osteopenia Reversible. If you have a history of stress fractures, specifically, actually, it doesn't matter how you're getting them, but if you have a history of stress fractures, then asking for a DEXA scan would not be unreasonable at all, no matter what your age is. So is osteopenia reversible? Great question. Thank you for your answer. Good. So with a history of stress fractures. Okay, good. Thank you. So osteopenia, is it reversible? So osteopenia with certain medications, and again, this is a question to have with your physician, with certain medications, in addition to lifestyle changes, you can get your bones stronger for sure. So you can prevent it from going to osteoporosis, which is really the key. So osteopenia, I will not say it's not a big deal, because it's a big deal. What you want to do is prevent it from going into osteoporosis. So knowing that you have osteopenia, even though I mentioned that, you know, if you want to treat your body as if you have osteopenia, if you're at a certain age, closer to menopause or perimenopause, there are certain medications that have been proven to, you can start, that are FDA cleared, that you can start that help to prevent you from going from osteopenia into osteoporosis. So at a certain age. So if you're at age 32 or even a little bit older, but you are not close to perimenopause or menopause, then it wouldn't be appropriate for you to start these medications. But as you get closer to a certain stage, then you are absolutely at an appropriate stage to start medications to prevent your body from going, or your bones from going into osteoporosis, if that's a choice you want to do. So that's the important part about knowing at a certain age where your bone health is. So is it reversible? Building it back up into 100% bone health, we're not 100% sure, but can we prevent it from going into osteoporosis? Yes, we can do that with the help of medication and diet, a diet rich in calcium, vitamin D, and bone exercise, weight-bearing exercise. What's the name of the urine test is 24-hour urine test. That's all it is. That's the name of the test, 24-hour urine test. Okay. I'm looking, okay, so I'm looking at some questions about medication, and I'm going to get there in a second, but I do want to answer that with medication. I can give some brief answers, but I really want everyone to talk to their doctors about medication, because it really is a very individual situation. So I am going to I'll touch on medication a little bit, but getting to your endocrinologist to get the prescription that's right for you is really, really key for sure. So is osteoporosis reversible then? So again, getting into certain stages in osteoporosis, and then there are certain medications, and I've been seeing it more and more when following the protocols of the medications that are being prescribed 5 years on, and then going off of them for a couple of years, following a diet that's very rich in calcium, as well as vitamin D. But in addition to that, so let me back up for a second. I did mention, and I'll get now into a little bit on medication, but I'll go back and forth on that. I did mention in the beginning that bones are constantly regenerating. So they're breaking down and then they're building up, breaking down and building up. So the medications, some of the medications that are prescribed are in a constant state of build. So the reason why you want to go off of them is because then those medications allow, when you go off of them, the bone to sort of, and I'm simplifying it, but allow that bone to kind of not break down to, break, but allow that natural process to happen again. And so we have to let that happen. So that's the key there. So when I've seen patients, clients of mine, follow that regimen when they've had osteoporosis, and they followed the medication regimens, as well as followed a very healthful diet rich in calcium and vitamin D, as well as a diet that's been lowered in caffeine, lowered in things that kind of pull, or we call it leaching calcium out of the bone. So there are certain foods or things like phosphorus, dark colas, that's what, like, what's in your dark colas is phosphorus that leaches or pulls calcium out of the bone. Caffeine pulls calcium out of the bone. So diets that are low in phosphorus, also diets that are low in alcohol. We see osteoporosis, bones getting stronger. So some people's levels, so depending on how I don't want to use the word, how deep their osteoporosis diagnosis was, their DEXA scans improve, and some people have gone back into the range of osteopenia. So if your osteoporosis was down here, and let's say osteopenia is here, they'll get closer and closer and closer and closer. But if you started here, you might go back up into here, if that makes sense. So it really just depends on where you start, what regimen you're following, and where you're going with it, and what your lifestyle brings. So it really just depends. So let me just see here. Oh, there's always hope. Believe me, there's always hope for sure. Okay, and I'm going to go back into all the questions now. So is there a number to look at with my osteopenia diagnosis that I compare to each bone density? Yes. Okay. So I'm going to say these numbers very slowly so you can write these down. So there's a thing called a T-score, as in Thomas. And there's going to be 3 things I'm going to say. So a T-score of -1 and above is considered normal. These are your DEXA scans. So a T-score of -1 and above is normal. So that means that 0 to -1 is normal. -1, and here's the second thing I'm going to say. -1 to -2.5 is osteopenia. So if you're looking at like a numbers scale or numbers chart, you're kind of looking at the negative side, 0 to the left. So I hope this is making sense. And then the third thing I'm going to say is that -2.5 and below is considered osteoporosis. So let's say you had a -2.9 when you were first diagnosed with osteoporosis, and then you spend 3 years on certain medication, diet, exercise, and then you came back with a -2.4 and you went into the osteopenia range. Does that make sense? So that's the scale. Now I'm going to go up into the chat box and go into the questions. So this next question is, what trade-off would you make as a nutritionist for someone who has osteopenia and also a high total cholesterol with an excellent ratio? What options are there besides more dairy in the diet, or do you just go with the calcium supplement? So the question I have back is, is there a reason that this person is avoiding low-fat dairy? So if you can just answer that. So you can simply, and I say simply, you can go for a calcium if you're avoiding dairy because you're worried about the fat in dairy, then go for low fat dairy. But if you're avoiding dairy for other reasons, you can get calcium from other food sources or simply go for a calcium supplement. But let me see if you answered. Don't care for low fat dairy. Great answer. So you can get your calcium from other food sources, whether it's leafy greens or dairy alternatives, whether it's, you know, if you like soy products or coconut-based products. It's hard to get them in. It's hard to get enough calcium in on a daily basis. And, you know, it's real life, you know, it's very, very hard. So you may want to go for a calcium supplement, calcium citrate versus calcium carbonate. Calcium citrate is easier to absorb, easier on the stomach, less gas, less bloating, slightly more expensive. Is it worth it? I believe so. It's what I take. For calcium supplements, you never want to or need to take more than 600 milligrams at a time. Your body will not be able to absorb more than that. The average person needs 1,200 to 1,500 milligrams a day of calcium. So you can kind of figure it out based on what you're taking in through food. 2 to 3 servings of dairy a day is about 1,000 to 1,200 right there. Most people don't get that in on a given day. And again, if you want to take the calcium, the 24-hour urine test to kind of put it into perspective for you. As a registered dietitian, and I do believe I follow a pretty healthful diet, I take in probably, you know, I think plenty of fruits and vegetables. I try to get in as much calcium as I can through food. And then I take 600 milligrams of calcium citrate in the evening. So just to kind of put it into perspective. So, and that's after I've taken a 24-hour urine test. So, and I always share what I do. So just to kind of put it into perspective. So there are a lot of products out there. Calcium citrate is one, the type, you know, I don't particularly have a brand that I endorse per se. Feel free to email me at erica.christ@greenwichhospital.org anytime, and I can share with you, you know, the brand that I take. You know, I just don't endorse anything in particular. But any calcium citrate should be fine. Okay, so let me go back up again. Okay, we have some time left because I know that there are more questions up there. Okay. So what about going to OsteoStrong for vibration exercise? So getting into exercise, so osteopenia and osteoporosis are, again, when it comes to exercise, they're two very different situations. And there's two very different types of moves that are key. Exercise is extremely important, and we know this, for bone health. So weight-bearing exercise, meaning anything that puts any kind of pounding, not heavy-duty pounding, but any kind of pounding on the bone is weight-bearing. So walking, jogging, running is weight bearing. Swimming, an elliptical is not weight bearing. Doesn't mean it's not good for you, it's just non-weight bearing. So the other issue is what is proven, what is not proven, what do you do about starting new forms of exercise with a new diagnosis, and how do you handle that? So again, with osteopenia, your bones are soft. With osteoporosis, your bones are brittle. So with osteoporosis, excuse me, you can have some movement and you can have certain types of movement, and you can have literal cracks or fractures that occur in the bone. So it's very important that when you have that type of diagnosis, that any type of exercise you do, you get with a qualified, you get into a very structured, proper exercise regimen that doesn't involve anything that can compromise that bone, those vertebrae, specifically any type of what is called flexion or overflexion exercise. And this can be, looking at the time, we can do a different presentation on this at some point, but overflexion exercise, which can really compromise the bone, and that if done improperly, that type of forward rounding too much can actually compromise the vertebrae when you have osteoporosis. Now, extension or lifting of the upper back is one of the most important forms of exercise that the body can do, and has been shown with osteoporosis, has been shown in studies to be one of the most valuable, in addition to weight bearing, one of the most valuable exercises for the upper back and the safest, and for long-term postural health for women in particular with osteoporosis. Now, with osteopenia, which is the softening of the bones, it's very different. The research is not as strong as to what a person can and cannot do. What we do know, and what I do know, and what I do with my own clients, particularly my fitness, my Pilates clients, we have to be very, very careful because bones are now soft, and whether a person is, we want to prevent any further or any damage to the bone. So I need to make sure that those vertebrae are really getting away from each other and not collapsing on each other, because even though they are not at the same level of risk for getting those fractures, I want to train those vertebrae to get away from each other and not collapsing on each other. So starting anything new, you have to be very, very delicate, and starting anything new, you have to make sure that you're with a very qualified person who understands that bone health and that understanding. So with regards to different forms of exercise, I'm just not well versed enough on the research of other chains or other what the latest is on other forms of exercise. I'm just, meaning, I don't want to say fads because things aren't fads, but I'm just not up to what their latest research is at other places. So I just know what I know about general weight bearing exercise and what it is that I practice for sure. So back to the medication, and I'll get into this just a little bit. And again, we just only have a few minutes left. So anything that I don't answer or quite frankly, should really go to your doctor as well. So biphosphonates, which are the most widely prescribed, let me get back to the question though as well, so I understand what the question is. Okay, so a 70-year-old woman with some osteopenia and borderline osteoporosis, how do I decide whether to take Fosamax or Prolia? Okay, I started Fosamax that had to stop because of dental implant work. Okay, what are the problems with potential problems with Prolia? Thank you. That's a great question. Okay, well, all these questions are great. So biphosphonates are the most widely prescribed: Fosamax, Actonel, Beniva, and Prolia as well is one of the other, one of the newer, well, not so new anymore, but one of the newer medications that is prescribed also. And both of these need to be monitored with regards to dental implant work, meaning that when a person has one of the side effects, one of the possible side effects is that if you're on this medication and you have dental work, severe dental work that goes into the jaw, meaning you have dental implants, not a cavity filled, but something that drills into your jawbone. One of the potential side effects is that you could have delayed jawbone healing. And that's with biphosphonates as well as Prolia. So as a result, what happens is, it's not that you don't take these medications. What you do is you do several things. You work together with your dental team and your endocrinologist, and you get your teeth worked on, cleaned, etc. And then, and I understand that this person had to go off of this medication because of dental work, which was the right thing to do. And then you get everything you need to get done, and then you start the medication. And then you get your teeth cleaned regularly, and then you take care of your teeth as best you can. Then your dentist knows that you're on this medication. Then if you need to get dental work done into the jaw, you stop your medication, whether it's Prolia or Fosamax, and then for at least 6 months, and then you get the dental work done, and then your jaw heals because you've been off the medication. And then you go back on the medication that you choose, whether it's Fosamax or Prolia. And in the meantime, when you're off this medication, you work with your doctor for an alternative to what to do in the meantime. This way your jaw is protected, you're off these medications, but you need to do something as an alternative when you're off these medications, specifically Prolia. Because when you go off of Prolia, you're at a pretty high risk of bone fracture when you're off of it. You need to take it every 6 months. It's an injection every 6 months, but when you go off it, you need to do something else instead. And that's a conversation to have with the doctor. So what you've done, the person who asked this question did great. So everything, you know, you worked with your team, you went off the medication, did what you had to do for your jaw, so all is good. And then the question is, do you go back on Fosamax? And if it worked for you, great. If you want to go on Prolia, great. It's a different lifestyle, meaning you go in, you get a shot every 6 months, and then that's it. Fosamax, I'm not sure if you were taking it on a weekly basis, if you were getting injections on a monthly or a quarterly basis, you can get it either way, but it's a different lifestyle. There's risk factors to every medication. There's insurance issues as well. Sometimes it's harder to get Prolia. You have to be on Fosamax for a while. It depends. But either way, if you need to get dental work done, you have to go off of both either medication and then get an alternative in the meantime. I hope that answered the question. So we are just at about our time. Oh my goodness, there's 8 new messages. I hope that okay, so. And then there was a question about Prolia or bisphosphonates. So I hope that that answered the question as well. And then you see my email address, erica.christ@greenwichhospital.org. Email me anytime, any questions. And leafy greens, calcium, cooked or raw. The quickest you can cook them, the better. The rawer the food, the better it is. And if you cook them, drink the water, meaning soup is best because all the water soluble stuff goes into the fluid. And I think that's everything. So thank you so much. I'm so glad you were all here. Have a great day, everybody. Enjoy this gorgeous weather.
Thank you, Erica. This was very informative. Thank you so much. And thank you everyone for joining us today.
Bye-bye.
Bye-bye.